It's ready and waiting for you when you go solar with Sunlux. Learn more at sunlux.com, sunlux.com.
This is the KBLA Sports Minute with Ray Richardson.
Kawhi Leonard's return to the lineup last night was not enough to inspire a win for the Clippers against Dallas. The Clippers lost by 3. The best-of-7 playoff series is even at a game apiece. Luka Doncic had a game-high 32 points and 9 assists. The Clippers were fortunate to lose by only 3. They shot a season-low 36%. In his first game since March 31st, Kawhi played 35 minutes. He had 15 points and 7 rebounds. Kawhi's right knee seemed to hold up pretty well. The question is, will he be healthy for Game 3 Friday night in Dallas? Don't be surprised if Lakers coach Darvin Ham shakes up his starting lineup for Game 3 Thursday night against Denver. Rui Hachimura has been a non-factor in the first 2 games. Hachimura has made only 3 of 11 shots and has only 4 free throw attempts. For a guy playing 34 minutes a game, the Lakers need a lot more production from him. No debates, no speculation, just the info you need. That's your KBLA Sports Minute. I'm Ray Richardson on KBLA Talk 1580.
KBLA Talk 1580 is the fastest growing talk radio station in Southern California. Home to 50,000 watts and an audience reach of 12 million listeners. KBLA Talk 1580 is a pioneer for Black audio content, including our groundbreaking $2 million climate justice campaign and the most loyal, influential audience. According to an independent research study by the polling firm Aviterus, for the second consecutive year, KBLA Talk 1580 is the most trustworthy, reliable, and credible news source for Black audiences and beyond in Southern California. Let KBLA Talk 1580 power your advertising dollars. Our omni-channel custom marketing solutions are specifically tailored to connect with your ideal target audience. We leverage audio, podcasts, streaming, digital, social media, and local activations to get your message out to the Black community. Get in touch with our advertising team today at advertising@KBLA1580.com. That's advertising at KBLA1580.com. KBLA 1580. We've got your Black.
First things first.
Things first, it's the DU General, Money B. I'ma put you up on the schedule, 6 to 9, 8 weekdays, not 2 and 7. Let's go. We got a lot to talk about, so much to pedal through. Unapologetically progressive. Tune to KBLA 1580 to get the mess. We're your ancestors' favorite radio station. First Black on talk radio, left side of the nation. Me and Dominique DiPrima go way back. Tag Smiley making sure the station stays black. Discussing all the issues in our community. We're hosted Black and Brown and others find unity. So let's talk about it. Maybe we can improve it. Digital underground, always down with the movement. So we tune in. The first things first with the queen of Black Talk Radio, Dominique DiPrima. Go sis.
First things first.
Good morning and God bless. I'm Dominique DiPrima. The show is called First Things First, and my first thing every day, giving thanks, giving praises, and asking for blessings from God, asking for the blessings of the ancestors and the elders, and getting it started. Let's get it started, LA. Let's get it started, USA. So the way we do things on First Things First, hour one, we look at what's happening on the left coast, the Pacific Ocean side of things. Hour two, we go national, international, and beyond. In the third hour, we do a deep dive with a person or a hot topic, etc., etc. And today is not so much of an exception. We got a little something here and there. Actually, it is, we'll be hearing a big announcement regarding education and in hour two. And of course, it is a Wealth Building Wednesday. Really excited to feature a Black-owned business today. And he'll be coming live in studio. So that is, it's a jam-packed show, actually. And we've got great things coming all week long. Tomorrow we'll be hearing from Congresswoman Maxine Waters. She is, she'll be checking in with everything, the crazy town that's going on in Washington, D.C., and letting us know about some projects she's working on. She never stops going. And of course, Freedman Fridays this week, and every week, a second hour of Friday's show is dedicated to reparations, the fight for reparations, where we are, learning about what's going on in the different states, cities, even countries, and of course, all that is happening within the movement for reparations. Different philosophies, all comers. It is meant to be a comprehensive conversation. Joining me right now in the studio this morning, we have a guest we've never actually talked with before. Lots of that going on this week. He is Chief Medical Officer at the To Help Everyone Health and Wellness Centers in Los Angeles. He's a family medicine physician and HIV specialist practicing in South Los Angeles. He's got his undergrad from Morehouse. It's been a Morehouse couple of weeks, and his medical degree from the University of California at San Francisco. Dr. Derrick Butler, good morning.
Good morning.
How are you doing?
Oh, thank you, Dominique. Very good.
We focus on what's going on locally in this hour, and many times it's hyper-focused on politics. But all of these things intersect. And I think my experience during the emergency phase of COVID was that a lot of us pivoted to what is available, what resources are available, and what is the state of our health in South Los Angeles. And I feel like To Help Everyone Health and Wellness Centers are probably underrated or unsung in a sense. So talk to me about what it is that you're doing.
Thank you. So our clinic is what's considered a FQHC, or Federally Qualified Community Health Center. And our work is providing primary care to underserved populations in various parts of the country, both urban and rural. And ours is focused on the populations here in Los Angeles. I'd say at least 99% of our patients are African American or Latino, mostly low income. Most are now patients on Medi-Cal, a smaller group of seniors, and a patient population that has in some ways struggled from what we call the disparities in terms of chronic diseases. So we have lots of patients who are diabetics, hypertensive patients, patients with COPD. And I'm the director of our HIV clinic at our facility, and we have 5 sites. And we offer primary care services, either low cost or no cost. Our main clinic is on 38th and Western, about 1 block south of Exposition, near the Expo Line station there on Western. And 4 other sites, 2 in Inglewood, 1 at Crenshaw High School on the campus where we serve the teenagers, and another on La Brea in Coliseum.
So, I know you specialize in HIV, and when you said that, it kind of threw me back because I've been on the radio long enough to have had all kinds of conversations about AIDS and HIV, in it being a much more top-of-mind kind of conversation than it is now. It seems to have drifted into the background. How much of an issue is this still in our community?
I would say specifically in our community, it's still an issue. African Americans make up over, as you know, close to 50% of people in the United States living with HIV, and close to more than 50% or 40 to 50% of patients with new infections. And this includes both men and women. Specifically for women, African American women make up probably 60 to 70% of new infections with HIV. Now, the upside of having HIV now is that the medication is excellent. People can take as little as 1 pill a day, or even now get 1 shot every 2 months to completely control the virus, keep it at undetectable levels in the body, and live pretty much the same lifespan as someone living without HIV. The problem is that we have what's called social determinants of health, such as housing insecurity, food insecurity, substance use, mental illness, We even call sometimes racism, access to health care,
Right.
which contribute to the disparity in terms of the outcomes, in terms of new infections and those who are at highest risk for HIV.
So, in other words, not all HIV/AIDS cases are the same because the conditions of the person, the human being that is dealing with that health challenge, impact how well they're able to resist it or thrive.
Or thrive, or either, well, two things. Either not get infected, number one. Many of those factors are the risks that lead to someone being at risk for being infected, and also the success of treatment is many times associated with those social determinants of health. If you're not stably housed, you have problems getting food, you don't have access to health care, you can't get the medicine, which is so easy to take with that would keep you alive and healthy. And, my biggest, I've been an HIV specialist for over 20 years now. And I've seen the dark era, the dark days of HIV when we had very little treatment and most people were dying of AIDS, to now where anyone infected now should be able to live their full lifespan. And my philosophy is no one should die of AIDS in 2024, period. There's no reason.
So the reason people are dying from AIDS now is because they don't have the information or they don't have access to health care.
I'd say, well, both. They don't have information. There's lots of stigma around HIV. It's associated with being homosexual or being a drug user, being promiscuous, et cetera, those buckets that people don't want to associate them with. I will be real. I think in African American and Latino communities also, we have a fair amount of homophobia, as we do over.
Surprise.
Surprise. Well, that's
especially,
the environment now.
I don't mean to be ageist, but maybe I am being ageist. I think with older folks, I think there's much more anti-LGBTQ plus sentiment among older Black folks. My experience, I do have a teenage child, is that peer group is not as worried about it as we are, and the ones before, the generation prior, even more so.
No, agreed. And as you can see now in the politics now, the divisiveness in terms of this rhetoric around the LGBT community, that is still persisting, and those messages are just, pervasive. I won't quote which political party seems to be pushing that agenda. I think it's pretty obvious.
Yeah.
But for me, that's a step backwards in terms of how we're going to affect healthcare in this country, especially in the HIV/AIDS arena, because we have preventative care. You've probably heard that in some of your shows.
You're talking about PrEP?
Around PrEP, exactly.
Okay, explain what PrEP is.
So PrEP is, it stands for pre-exposure prophylaxis, meaning it's medication that someone can take to prevent themselves from becoming infected with HIV. So I call it, the easiest analogy would be birth control. So someone takes birth control, either a pill or a shot, that prevents them from becoming pregnant. In the same way, you can take a pill or a shot to prevent yourself becoming infected with HIV in the same way. You can take daily treatment with the pill, or you can take pills right around the time you have sex, or you can get an injection every 2 months.
So the things that I have talked about on prior shows, but probably not for a long time, is the fact that there's a lot of seniors getting HIV and AIDS. And I think that flies in the face of some of the stereotypes that we are talking about.
Oh, absolutely. I could even say probably my last positive patient I had last month were a couple, in their 50s, a Latino couple in their 50s. And what happened was the wife, ended up at LA County General Hospital with a huge outbreak of shingles. I'm not sure if you know, shingles is
like chickenpox,
it's
right?
the chickenpox virus that
chickenpox
all of us have.
For old people.
Well, what happens is it officially you're old when the chickenpox comes back as shingles, because you get it when you're a kid. It kind of stays locked down by your immune system, and then it comes back when you get over 50. So she had shingles, but it was very severe. She went to the hospital, and she had an HIV test. It was positive. This woman was 56 years old. And now the question is, where did she get it? She's only been with one man her whole life, this husband. And so they came to our clinic, and we tested him. He was positive. And again, someone in their 50s, you would not think this would happen. And so I won't say of course, but of course I don't know where it came from, etc. And then now there's some finger pointing, and then finally it comes out that he had some extramarital activity and became infected.
He did admit to that.
He did eventually admit to that. He was having sex with other men. He was using meth. He had this whole
she had a whole situation.
Yeah, he had a whole nother lifestyle going on.
Her whole life fell apart.
And
of course, I'm
is,
looking at it from the woman's perspective. But
absolutely. But
right.
you think of the age. You think this is something young people would do.
Right.
But it happens even in older folks. So you do get some of that demographics. I would say 90% of the women that I have in my clinic got it from, their husband or their boyfriend. Sometimes it was their only partner.
Right. And that guy, I mean, he could be having sex with men, or he could be using drugs, or he could be having sex with women who have HIV, right?
True that.
I mean, it could come from anywhere, but the reason I say that is because I think my experience talking to seniors about this, they are in denial about it. Mm-hmm. Even though some of the seniors out there, some of y'all are out there playing around. Some of them are, not to put people on blast, but promiscuity is not just for young people.
Nope. It's interesting in the story. It's not funny. They've kind of had this scenario where, for instance, especially older women, right? So many times when they're through menopause, they're not necessarily worried about getting pregnant. So they may not use condoms. I don't need condoms. I'm not going to get pregnant.
Right.
Or say they're widowed or they're divorced, etc. And they're like, well, I want to get back out there. I've been married for 25 years. This is over. And they kind of want to get back out there and, start dating again. And sometimes that they can put themselves at risk because they may not be protecting themselves because they don't think, again, part of it is this, I would say, not fallacy, but the belief that, people my age, again, the stigmatization of HIV is, this is for people who are men of sex with men, or I don't use drugs. I don't sleep with men who have sex with men. I don't think I do, etc. I'm not promiscuous. And then they kind of discard that you can get HIV from one person, one time, just trusting that person.
Right. For the streets, you don't know. You don't know unless you know. So I'm not saying that to make everyone feel depressed, but I think that I just feel like when I first heard about that, it kind of surprised me, and I realized that these are things we don't talk about, we don't think about. Now, PrEP, when you talk about taking PrEP, which is something you could take to prevent getting HIV, anyone can take that, even that woman, 56-year-old woman whose husband was for the streets.
Oh, yeah. Anyone can take it. Obviously, I'll have to put a plug. Condoms are probably the best way to...
Condom is the safest.
It's yes, it's safest and probably most effective as long as they're used correctly, etc. So I have to put a plug, and they protect you from other STDs. I mean,
right, which reminds me, okay, you know what? We'll talk about this when we come forward. I remember reading in the Los Angeles Times about a supposed syphilis outbreak in LA County, and then the story just went away, and I'm like, how is this just going away? We'll talk about that and more when we come forward on KBLA Talk 1580.
She's reclaiming her time on KBLA Talk 1580. More First Things First with Dominique DiPrima when we come forward.
Now your ideas don't have to wait. Now they have everything they need to come to life. Dell Technologies and Intel are creating technology that loves ideas, loves expanding your business, evolving your passions. We push what technology can do, so great ideas can happen right now. Find out how to bring your ideas to life at Dell.com. Welcome to Now.
We've got a lot to talk about.
Hi, I'm Ray Richardson, your sports connection here at KBLA Talk 1580. Join me and my co-host Neil Scarborough every Saturday night at 7 for Out of Bounds, the show that brings some flavor to the world of sports for 60 minutes. We take you beyond the scores and press conferences. We give you our point of view, the way black folks see what's going down. You can join the conversation and give us your analysis at 1-800-920-1580. Out of Bounds, every Saturday night at 7 on KBLA Talk 1580. We've got a lot to talk about.
Unapologetically progressive. KBLA Talk 1580. We've got your black.
You like the style, though?
Hi, I'm Reverend Gerald, host of Urban Family Focus here on KBLA Talk 1580 on Saturday mornings at 7 a.m. In an effort to help reduce the impact of hypertension in our community, Providence is offering free hypertension assessments. The first 30 people to visit KBLA1580.com and use the link or QR code to register will receive 2 tickets to the Amazing Grace Conservatory presentation of Aladdin, A Whole New World for Real, at the Crenshaw Performing Arts Center, May 25th and 26th. Go to KBLA1580.com right now and be one of the first 30 to register for your hypertension screening and receive 2 tickets to Aladdin, compliments of Providence and KBLA Talk 1580. At KBLA Talk 1580, we've got your black.
Yeah, y'all, come on. Come to drum.
At KBLA Talk 1580, we fight the power every day.
Yeah, gotta give us what we want. Gotta give us what we need. Hey.
I listen to KBLA and I love the commercials. I know what the commercials mean. I also, if I'm looking and trying to figure something out, I need something to talk to me that might hit me. And it happens on TV because, you know, every time they show a sporting event, they got the pharmaceutical companies back to back telling people how to fix the sickness on the same stuff that they sell them. So we get it.
Yep, we get it too, Chuck D. And that's why at KBLA Talk 1580, we don't black down.
Drop it. Our freedom of speech is freedom of death. We got to fight the powers that be. Fight the power. Fight the power.
Your ancestors' favorite radio station, and your favorite morning show host. Let's get back to Dominique DiPrima right now.
Right now, the doctor is in, Dr. Derrick Butler, that is. He's the Chief Medical Officer at the To Help Everyone Health and Wellness Centers. And I do want to, let me go here before I forget. It's syphilis outbreak. I read about it. It's in L.A. County, meaning that if you're out there doing what you're doing, you could actually get syphilis. And is that still going on? Is that a thing?
Yes, there's still a syphilis we call outbreak in terms of higher rates of syphilis than we've seen in previous years. And this has been happening probably over the past, I'd say 3 to 4, 5 years. We think it's linked. And you can look at statistics on the LA County Department of Health website, and they do monitor the cases. Many of it linked to the methamphetamine epidemic we're having.
Why? Because is it because people are sleeping around more when they're on meth, or is there some causal connection?
Oh, absolutely. It's not necessarily biological, it's more behavioral. So
I got it.
The drug itself, think of, I always call meth crack on steroids. Because meth is worse than crack in terms of its addictive potential, and it's harder to actually get clean from or to stop taking meth.
Really?
It's an extremely powerful stimulant, as you know. And many times the behavior that leads to meth use or is encouraged and sustained with meth use is that the fact that, obviously to get drugs, people will have unprotected sex. There's transactional sex to get meth. And meth is used as a stimulant. Some people, you're on meth.
Are black folks doing meth?
Believe it or not, we are. And that was what I was, when I was starting working with patients on it. I said, okay, we always assumed meth was trailer park, small, town, kind of, white hillbilly type drug, et cetera. But it's definitely here now in the inner cities. And I see, myriad of patients, African American patients who use meth. And unfortunately, those are the ones, especially my HIV clinic, who do the worst because they can't stay on their medication. Or I have people sell their HIV medication, believe it or not.
Who would buy that?
That's what I said. And he said, no, people buy it.
Wow.
And then they will go sell it like in Mexico or go sell it somewhere else where they can't get the type of medicine we have here. But anything's transactional now. And meth is, you could call it it's a stimulant so people can stay awake and stay energized for 2 or 3 days. And it's used sometimes, I would say, a party drug, but as a, so I'm a patient, it's a sex drug, especially in the MSM community where you can take meth and you're going for, hours and hours and hours. And it just almost feeds that. So, yeah, Viagra and meth, you are Good to go.
Meanwhile, you're breaking, I mean, I don't know about Viagra, but with meth, methamphetamine really breaks down the body.
Yes, it does. I tell people, think of your body going like a car. You get into a car and you run at 100 miles an hour for like 3 days straight. You know, what's that car going to look like at the end of that? That's what you're doing to your body and your brain. That's the problem too.
And so from what I remember from reading about the Tuskegee, they don't want me to call it an experiment. I forget what the right term for it is, but y'all know what I'm referring to, that people can have syphilis and not know it.
Absolutely. It can, usually the primary syphilis is a small ulcer that can be in the genitals, but then that it's painless usually. Some people may not notice it or think, oh, it's just a little bump or something. But it then goes away. It clears off in a couple of weeks. And then they won't necessarily see anything. And then that's called primary syphilis. And then what's called secondary syphilis is once that infection continues to propagate and now it enters the bloodstream, and now you can get rashes all over the body. You can get lesions in your mouth, other lesions in the genitals, etc. Usually that's when people definitely notice it and can get treatment. And then what's called tertiary syphilis, which takes months. Usually then it can get into the brain, months to years, get into the brain, get into actually the eyes, the heart, etc.
Wow.
And so usually if you see it initially, you can treat it pretty easily. And that's why we actually screen for it very
routinely.
often. Routinely. It's something, if you haven't been screened for syphilis, you should. I think if you're getting any type of checkup, they should be doing STD screening for everyone, which includes syphilis, HIV, viral hepatitis. Many people have heard of hepatitis C, hepatitis B, obviously gonorrhea and chlamydia, because some of those can be asymptomatic, not have symptoms, especially in women who may not know they have gonorrhea or chlamydia. Men usually know because they'll be burning when they go to the pee or see something or discharge, but women may not. So always get routine STD screening is the highest recommendation I can give.
Wow. So we only have a minute and a half here till news, traffic, and sports. We'll continue on the other side. As far as coronavirus, you know, the meme is, what happened to all these supposed dangerous strains? Are we out of the emergency phase? And the thing that made me think about it is I know that any of these conditions and COVID or long COVID combined sounds like a recipe for disaster.
Oh, yeah. You are correct. And I would say what we know now around COVID is it's pretty much considered to become endemic, meaning it's still at very low levels now.
Meaning it's not going anywhere.
It's not gone,
right.
But it's not in terms of an epidemic portion or an outbreak that we had before, mainly because most people have been vaccinated to some degree, so that does offer some protection. Although you hear about new strains and variants that kind of can pop up, which may not, where prior vaccination may not allow protection, but typically people will have less severe illness and maybe less infectious to other people. So, but it's still slowly percolating because there's still cases popping up, and again, but not as severe as we had early on, because there is some immunity from people who already had COVID. I had it twice, and who've been vaccinated.
Yeah.
And I've gotten 4 vaccinations and had it twice. So
wow.
Hopefully I'm not going to get it again.
Hopefully you're done.
But think about it getting the flu every winter. You might have COVID there too.
Talking with Dr. Derrick Butler and you on KBLA Talk 1580.
More of First Things First with Dominique DiPrima when we come forward.
I'm Amber Payton. Here's the latest on the Black Information Network. New York City Mayor Eric Adams is meeting with college leaders amidst ongoing pro-Palestinian protests aiming to prevent escalation. Adams, who is black, emphasizes that schools like Columbia and NYU are for education, not managing volatile situations. He warns of outside agitators inciting violence, urging schools to tighten security and identify non-students on campus. President Biden is set to speak at the commencement ceremony for one of the country's top historically black colleges. Biden will speak at Morehouse College for the ceremony scheduled on Sunday, May 19th. Posts on social media have been calling for students at the college to stage a walkout in protest of Biden's support for Israel. Biden has reiterated support for the country in the wake of the Israel-Hamas war. Both Biden and former President Trump have been campaigning around Georgia to influence black voters in the state. That's the latest. I'm Amber Payton on your home for 24/7 News, the Black Information Network.
Hey, it's Dean Sharp. Great news. Sunlux has the all-new Tesla Powerwall 3 in stock. It's ready and waiting for you when you go solar with Sunlux. Learn more at sunlux.com, sunlux.com.
This is the KBLA Sports Minute with Ray Richardson.
Kawhi Leonard's return to the lineup last night was not enough to inspire a win for the Clippers against Dallas. The Clippers lost by 3. The best-of-7 playoff series is even at a game apiece. Luka Doncic had a game-high 32 points and 9 assists. The Clippers were fortunate to lose by only 3. They shot a season-low 36%. In his first game since March 31st, Kawhi played 35 minutes. He had 15 points and 7 rebounds. Kawhi's right knee seemed to hold up pretty well. The question is, will he be healthy for Game 3 Friday night in Dallas? Don't be surprised if Lakers coach Darvin Ham shakes up his starting lineup for Game 3 Thursday night against Denver. Rui Hachimura has been a non-factor in the first 2 games. Hachimura has made only 3 of 11 shots and has only 4 free throw attempts. For a guy playing 34 minutes a game, the Lakers need a lot more production from him. No debates, no speculation, just the info you need. That's your KBLA Sports Minute. I'm Ray Richardson on KBLA Talk 1580.
To help combat climate change, LADWP is helping neighborhoods have better access to electric vehicles by awarding nearly $130 million in EV rebates to customers just like you. From big savings on used EVs to building new charging plazas, LADWP is charging ahead to help all Angelenos experience the benefits of EVs. Get rebates of up to $4,000 for a used EV and $1,750 for a charger. Learn more at ladwp.com/EV. That's ladwp.com/EV.
It's time for California Community College's Black Student Success Week. This week-long event, held April 22nd through the 26th, is an opportunity to focus on innovative approaches to ensuring Black and African American students succeed in their educational pursuits. Black Student Success Week 2024, building a better future together. The urgency is now. For more information, visit blackstudentsuccess.com. That's blkstudentsuccess.com.
KBLA Talk 1580 is the fastest growing talk radio station in Southern California. Home to 50,000 watts and an audience reach of 12 million listeners. KBLA Talk 1580 is a pioneer for Black audio content, including our groundbreaking $2 million climate justice campaign and the most loyal, influential audience. According to an independent research study by the polling firm Aviterus, for the second consecutive year, KBLA Talk 1580 is the most trustworthy, reliable, and credible news source for Black audiences and beyond in Southern California. Let KBLA Talk 1580 power your advertising dollars. Our omni-channel custom marketing solutions are specifically tailored to connect with your ideal target audience. We leverage audio, podcasts, streaming, digital, social media, and local activations to get your message out to the Black community. Get in touch with our advertising team today at advertising@kbla1580.com. That's advertising at kbla1580.com. KBLA 1580. We've got you, Black.
Getting connected has never been easier. Get free Wi-Fi at all LA County library locations, inside the library and outside in the parking lots. Visit your local library and get connected today.
Paid for by government. Did you hear? A secret hoard of 1893 $10 gold Liberty coins has been found. These gorgeous 1893p gold coins are as bright and shiny as the day they were struck, and less than 200 of these gold coins are available. Coin experts are calling this secret U.S. gold coin discovery a once-in-a-lifetime opportunity, and you can own a piece of the hoard. When you call, you are guaranteed an 1893 gold Liberty struck at the iconic Philadelphia Mint. With limited availability, you must call now. These 1893 dated gold coins are still in uncirculated condition with brilliant luster. That is 131 years of history you can hold in your hand. To learn more, call 1-800-473-3993. Call now and you'll receive a free bonus, a $50 value free with every order. Call 1-800-473-3993 now to secure your 1893p $10 Gold Liberty coins before they sell out. That's 1-800-473-3993.
Thanks for waking up with Dominique DiPrima on KBLA Talk 1580.
Man, so many things to talk about in our community. We're talking with Dr. Derrick Butler. He's the Chief Medical Officer at T.H.E Everyone Health and Wellness Centers. He is a medical doctor, a family medicine physician, and an HIV specialist practicing right here in South LA. Dr. Butler, before we move on to some of these, I got questions, and there's some questions in the YouTube chat, which is at KBLA 1580 on YouTube.com if you want to get in, have some fellowship this morning. If someone doesn't have health coverage, or they don't, maybe they're on Medicare, maybe they're not, like, how would they receive care from your organization, from the T.H.E Everyone Health and Wellness
Oh,
Centers?
excellent. And that's at least I think the good news about this is that California does now allow everyone to have access to Medi-Cal, which is if you meet income requirements. Usually if you're lower income, if you make less than $17,000 a year as a single person, or as a family, I think it's under $20,000 or so, you're eligible, even if you're undocumented. So you don't have to be a citizen to get this coverage, and it's full coverage for all preventative care, hospital care, etc. So to get care, basically you can come to our clinic or clinics like ours, other federally qualified health centers. You may have heard of Watts Healthcare in Watts, or APLA, St. John's. There's many of these out there. You can just Google low-cost care or no care. And so you basically would come and bring your identification, and usually they may ask for some proof of income, like maybe if you're on disability, or maybe working, say, a minimum wage job, etc. Or if you're just being supported by someone, you can bring a letter saying, my grandmother supports me, etc. And you can get health care. Usually you can get it that same day or the next day, and then you make an application for a Medi-Cal to be approved. I mean, most of us, pretty much all of us, will not refuse care. If you have zero insurance, if you come in, we will treat you, but we will also get you signed up for, full coverage.
What about those folks that fall in the kind of, in between space? I know there are people that are probably not qualified for Medi-Cal, and don't have Obamacare.
Yeah.
Health insurance is expensive.
That
Even with, and I guess, depending on where your income is, you can get subsidized by Obamacare. But I think there's a section of the middle class that doesn't qualify for subsidies or Medi-Cal, and may or may not have health insurance.
Oh, you're correct. And we find those people, that's that little donut hole of people who fit right in that, either that income that's just too high for Medi-Cal, but still low enough that health care will be a cost. And again, as you mentioned, with the subsidies for the Affordable Care Act, but that can still be a struggle for some folks. Now, there are other free programs that are out there. I would say they're more for women, for instance,
Interesting.
that are focused on, breast cancer screening, cervical cancer screening, those conditions that obviously primarily affect women. Also, STD treatment. Any woman who's pregnant will get care automatically, regardless of income. And STD treatment and screening is free in multiple areas, including our clinic. Care for teenagers along the same lines is a program called Family Pact, which covers those sexual health and family planning services. They're also free. So certain aspects can be free if need be. But I would say, just statistically, probably 90% of people can get some health care that is either free or affordable.
Yeah. Not to put you on the spot, Doc, but I am a big Medicare for all proponent. We say it's expensive, but we have money for everything else. But that's doesn't look like it's going to happen anytime soon. I want to circle back to the AIDS and HIV conversation for a second, not just because you're an expert on it, but a friend told me, I think maybe 3 or 4 days ago, I know they have a cure. You know, people are not dying from it anymore, and they're just not sharing a cure. How do you respond to that?
There is no cure.
I mean, I think one reason people say that is because of Magic Johnson.
Yeah, and Magic Johnson is not cured. Magic Johnson has been on treatment since he was diagnosed in 1992. He takes the same medicine that anyone can take, and you see he's living well.
You know no one's going to believe that.
But it's the same medicine. I tell people all the time, I have a homeless person living under a bridge who can take the same medicine that Magic can take. The key is he's committed to his health, committed to his family.
You look at his basketball record,
Yes.
and he's a freak of nature as far as being a human being
Absolutely.
who has incredible physical gifts. Plus, he's wealthy, so he's probably eating really well and,
No, it does
working out,
help.
taking care of himself. Yeah.
Oh, absolutely. In the earlier days when medicine was difficult, I mean, of course, he had resources, some of the best doctors, obviously able to eat the healthiest diet, etc. But the key is he took his medicine, and I think he's a great example and role model of how someone can live with it and live their lives to the fullest. And know that he's had children and his wife all HIV negative, mainly because he takes his meds. And when you take your meds, you're undetectable. You cannot transmit the virus to anyone.
Paul Lee is in the chat. I haven't checked this, but his information tends to be 100% right. He says Reggie Bush is getting his Heisman Trophy back. That's a little bit of a sidebar, but I think that's great news if true, and truly long overdue. But Paul also asked me to ask you if you have any information you can share about the H5N1 bird flu virus going around. I have to confess, Dr. Butler, that between Ebola and all these, bird flus and cow bovine this and that, for a while I was jaded. I was like, okay, they try to scare us every year with some flu thing. And then it was interesting with COVID at a certain point. I was like, oh, this is not another one of our annual scares. Because people would call me about Ebola, and I said, you're more likely to die from that donut you got in your hand right now than Ebola. But at a certain point, COVID reached critical mass, where I was like, okay, this is something we have to pay a bit more attention to. Which category would you put H5N1 in?
I'd put it very low on your worry bar, to be honest, for a couple reasons. Number one, it's not flu season. We're basically coming out of flu season, so the risk of any flu is much lower. Number two, it's again not ubiquitous, in the environment here. As the summer comes, the warmer months come, pretty much all respiratory viruses go down, and pretty much, we know every year there's a new flu vaccine that basically is developed to protect people from the flu that they see coming or predict is coming now to this hemisphere in the wintertime. Right. So I would say don't worry about it. I would say take your normal precautions you would take. Wash your hands. If you're sick or someone's sick, maybe not spend a significant amount of time or be close to them. Typically, if you're a healthy person, the flu is not going to kill you or hospitalize you. If you have a lot of chronic illnesses, you might want to be more careful. And it's interesting, during COVID, the flu rates were really low because everybody's wearing masks. So it's kind of a testament of how you can prevent even other viruses that aren't obviously as deadly as COVID just by taking certain protective measures.
I mean, honestly, the whole debate around masks really baffled me. Wear it or don't wear it. But ever since we were little kids, we've been taught to cover our mouth when you cough. It's not rocket science, and wash your hands, right? So, but, and then you did see flu rates go down and COVID rates go down when people wore the doggone thing. So I don't think that's rocket science. Wear it or don't wear it. It's your choice. Mm-hmm. I know you're going to hate this, Doc, but I just can't do flu shots.
No,
I feel like
understood.
they're making it up as they go along. Oh, we think there's going to be this and that and just mixing up some formula. I'm not fixing to do that. Although I did go and get a COVID shot. 2 of them, actually.
Got you. And again, I would say this. You're not alone, obviously. I say, and I feel everyone that makes their choices in terms of health and what they want to put in their bodies. I think that's obviously right. I give my recommendations and I give information.
And you did get the shots.
Yeah, I've gotten every booster. I work in a clinic. People bring
disease to
people
you.
bring disease to me, so I have to think about just taking every measure I can. But again, it's been actually studied. Washing your hands. Personal protection is almost just as effective.
The reason I'm making that crazy face is because I read a study that 36% of people wash their hands after they go to the bathroom.
That's all.
And
wow.
and I started telling my child, be part of the 36%.
Or at least. Well, it's funny. I was reading something about, when you go to the bathroom in a public restroom, you should use a paper towel to open the door to leave.
Yeah, for sure.
Because whoever went before you, of that 64% who didn't wash their hands, they touched that door to leave.
Yeah.
So you always think about that, right?
Yeah.
So
and never borrow anybody's phone. I'm just saying, unless
good
it's a dire emergency. I'm a germaphobe. I was a germaphobe before COVID, and it's even worse now. But I know that people take their phones to the bathroom with them.
Good point.
Among other places, and they touch it when they're doing looking at all kinds of things on that phone. So that's a no.
And how many people actually wipe their phones out and wash them, right?
Me, I do. Talking with Dr. Derrick Butler. If you have a question, you're welcome to call 800-920-1580. We are unapologetically outspoken, unapologetically hygienic, unapologetically progressive. KBLA Talk 1580.
A safe place to go loud. A great place for progressive politics. KBLA Talk 1580.
Prescriptions require an online consultation with a healthcare provider who will determine if appropriate. Restrictions apply. See website for details and important safety information. Subscription required. Price varies based on product and subscription plan.
Hey guys, did you know there's a generic form of Viagra that works just the same but is 95% cheaper? And you can get it online at hims.com/joy. Through Hims, you'll get a free medical consultation to determine the ED medication that's best for you. Discreet shipping if prescribed, a 100% online process, and a range of treatment options, including trusted generic alternatives to the name brands, at up to 95% off. ED is personal, and at Hims, so is treating it. Just go to hims.com/joy and get connected to a licensed medical provider online for free, with zero copay, no expensive appointments, and no awkward face-to-face conversations. To start your free online visit, you need to go to this exclusive address, hims.com/joy. That's hims.com/joy for your free online visit. HIMS.com/JOY.
We asked seniors how to prevent Medicare scams.
My best advice, if you get a phone call, do not talk to the person. These people are well-trained. Don't talk to them.
They don't know me. They're just trying to scam me.
Don't be fooled. Hang up. Just hang up.
Never give out your Medicare number.
They're going to get your number to put in a false claim.
If I get a call from someone, I don't pick up the phone, and should I pick up the phone and they ask for information, then I hang up.
How do you detect Medicare fraud?
Just like I check my credit card statements, I check my Medicare statements monthly.
Scammers can get a hold of your number, order medical devices through your account, and you're not even going to know about it if you don't look at your statement.
Check your statement every month.
If you get your statement and you see something that you know you did not have done, you report it.
Call your senior Medicare Patrol.
To report Medicare fraud, call the Senior Medicare Patrol at 855-613-7080.
Some days I cover up because of my moderate to severe plaque psoriasis. Now I'm hitting the road with clearer skin thanks to Skyrizi, Risankizumab Riza, a prescription-only 150 milligram injection for adults who are candidates for systemic or phototherapy. With Skyrizi, 3 out of 4 people achieved 90% clearer skin at 4 months. And Skyrizi is just 4 doses a year after 2 starter doses. Don't use if allergic to Skyrizi. Serious allergic reactions and an increased risk of infections or a lower ability to fight them may occur. Before treatment, your doctor should check for infection and tuberculosis. Tell your doctor if you have an infection or symptoms such as fever, sweats, chills, muscle aches, or cough, or if you plan to or recently received a vaccine. Thanks to Skyrizi, there's nothing on my skin, and that means everything. Ask your doctor today about Skyrizi, the #1 dermatologist prescribed biologic in psoriasis, and visit skyrizi.com or call 1-866-SKY-RIZZI to learn more.
This is KBLA Talk 1580, where hate loses and love wins.
Talking with Dr. Derrick Butler. And your clinics, you said there's 4 of them, or was it 5 or 4?
5.
5 of them. A couple in Inglewood, in South LA. I'm sure there's a website. It's not on my sheet here, but I'm sure there is. It's the To Help Everyone Health and Wellness Centers. And
it's tohelpeveryone.org. Just write it out.
That's easy. tohelpeveryone.org. Okay, so wash your hands, wash your hands, wash your hands. And Paul says, yeah, that's why he doesn't eat at potlucks. That's why you can't eat anybody's food. Real talk. Anyway, you said, we were talking during News, Traffic, and Sports, and you said untamed or unchecked chronic health issues are the biggest challenge for Black people. And that doesn't surprise me because my experience, being formerly married and being in relationships with Black men, is that y'all don't want to go to the doctor. And I don't even know if doctors want to go to the doctor, but I know Black men.
We're the worst. We're the worst because we already know what's wrong with us, supposedly.
Yeah, I mean, I've told the story before. I went so far when I was married as to get a really, really pretty Black woman doctor, see if that would make my then husband go. And it actually worked. Because I'm like, you got to get care. I'm willing to try something creative here. Why is this such a big problem? I mean, so what if I don't go to the doctor?
Well, the problem is, in general, especially as you get older, either from genetics or lifestyle, way you eat, if you exercise, if you smoke, etc., chronic diseases can start to pop up. Probably the #1 chronic disease in Black people is hypertension or high blood pressure, which many times is either not diagnosed, or if it is, it's untreated or undertreated because people don't go and get that check. And it's the most simple test you can take. You can go to the pharmacy and get a free blood pressure check, or you could pretty much go into any clinic. Mine, just come in, can I get my blood pressure checked, and check it. And if it's high, understanding that high blood pressure can cause long-term damage to the body. One of the kidney damage, heart damage. You've heard of heart failure. Typically comes from high blood pressure. It's unchecked. Think of the heart having to pump against super high pressures for years. It's just going to eventually, I say poop out. It's going to start to weaken, etc. The kidneys dealing with high pressures can start to be damaged. Blindness in the eyes, etc.
Wow. A lot of things.
It's plumbing. Too much pressure around the body can start to damage other organs. The #1 reasons people end up on dialysis, and if those of you don't know dialysis, where your kidneys basically have shut down and you have to be on a machine that actually performs the function of the kidneys, is because of unchecked high blood pressure.
Really?
Yep. And Black people make up a disproportionate number of people on dialysis, many times for not controlling blood pressure, not having it diagnosed. And the problem with it is that you can have high blood pressure and not feel any different because it can tend to creep up slowly. Your body adapts to it until
so you don't know you have it.
You don't know you have it because if you have high blood pressure and you have a headache or feel dizzy or have chest pain, it's already way too high. So some of those symptoms you have to be careful of, but it's a simple screening test to get your blood pressure checked.
I think one reason we don't want to get screened, Doc, is because we don't want the prescription. We don't want to know what you want us to do about it. Now I have diabetes. Now I have to stop eating this, this, and this. Now I have to take high blood pressure medicine. But I always say you're still in charge of your body. Go and find out what's wrong, and then it's up to you if you want to take the medication or cut down on your salt or start working out and exercising and change your diet. Like, how you address it is still up to you, right?
Absolutely. And the thing is, my approach has always been try to empower the person. Just let them know. I mean, again, there's a way you can get this message across. You can come in with the doom and gloom and try to scare people into doing something. That I don't think that's the most effective way. Some people just get reactive to it.
Right.
But, or sometimes using I think some people, like you mentioned, I think just feel overwhelmed, intimidated, because changing lifestyle is probably the hardest thing for anybody to do, especially if you become kind of set in your ways. This is what I like to eat. This is what I like to do. And they're afraid that I can't do those things that make me happy anymore. And I tell them, look, if you can change this, you can. If it's hard for you, start small. People think, I need to go. Everyone tells me I have blood pressure. And they say, well, exercise helps. So I'm going to go join a gym and start working out 5 times a week. And I said, look, let's just stop. Just be realistic. And I just say, look, you're not going to do that. If that's not been a part of your life already, you're not just going to jump in and do that. However, you can start. Why don't you just start walking?
Right. Walk around the block.
Walk around the block. 30-minute walk. They say minimum 30 to 45-minute walk 3 times a week is basic. Like you're kind of right at the minimum that's going to give you a cardiovascular benefit.
Right. Plus, I read a study, people that walk half an hour a day, 4 to 5 days a week, stay ambulatory years longer, meaning you can walk around. You don't need a walker or a wheelchair as soon. You might get another 5-10 years of walking around. That's worth walking around the block a few times every day, I think.
Oh, yeah, absolutely. They've studied people who lived into their 90s. They've done several studies that looked at what were the 3 things that were in common. Number 1 was not smoking. Number 2 is being active. And again, like you mentioned, walking, just a simple walking is enough. You don't have to be on a treadmill for 2 hours at a time. Walking, and sometimes even being active. If you're out gardening, right? If you're, going out and, working in the yard or doing something, people remember they had their grandmother still getting up, going in the kitchen, cooking, cleaning her house.
Electric slide, we'll do it.
There you go, getting out there, dancing, just going dancing, etc. And the third thing was actually being social, having a social network.
Yeah.
Which again, it feeds the soul. That's something human beings need, is to be social. So I tell the worst cases, if you're a smoker, you're an inactive, sedentary smoker who's basically alone.
Oh,
that's
wow.
the worst case scenario.
Sounds like one of my family members. I better check on her after the show.
No, absolutely.
So, I know it's a tall order. I feel like I'm always reading about Black people, worst outcomes for diabetes, worst outcomes for this, for that. To an extent, it almost feels like it can become a self-fulfilling prophecy. As someone who deals with us all day, every day, what's the number one thing that you wish we would do? I mean, other than walking around the block, which I recommend, if you're not going to be a fitness model, at least walk around the block.
My best thing is to have self-love. I think we've been conditioned in this country to not support each other, not support ourselves. And I'm not saying everybody, but I think we have, and you see that in so many areas of what's been happening in our culture. And health is one thing I think that we've taken for granted. And people just not understanding that how you treat your own body, having the self-love and feeling the self-worth of, my body's a temple. I need to do the things to keep it healthy, and understanding that, again, spreading that word to other people, trying to influence someone. I would say especially Black mothers, they have to kind of give these habits to their children, because children will model their mothers. The whole statement that if you teach a woman, you teach a nation, because she's the one who's going to propagate that information and teach her children, men, boys and girls, who will then propagate that going further. And, as there's lots of initiatives around Black mothers right now.
Yeah. Because
of that health disparity, there's lots of initiatives now trying to get for their health, but also the health of their infants going forward. And my message again to us is to, we have to, some ways, erase a lot of stereotypes, misinformation. And as you know, the society in general, I think, has tried to, denigrate us as a people, and not for us to internalize that and know, and distract us from the positives. And know that actually spills into medicine and health also.
Well said. Well, thank you for the work that you're doing. It's appreciated, and I think it's important for people to know. tohelpeveryone.org.
Correct.
Or if you've seen a To Help Everyone and you didn't know what it is, now
That's
you
us.
do. Stop in, see
Yes.
what's going on with your blood pressure.
Remember that. Our nickname is T.H.E.
T.H.E.
To
Clinic.
Help Everyone Clinic. T.H.E. Clinic. People may know us as that.
T.H.E. Clinic. Yeah, I've seen them.
Yeah.
Dr.
All right.
Derrick Butler, thanks for waking up early and coming in and talking to the people. We appreciate it.
Absolutely. Thank you for having me.
Wealth Building Wednesday next on KBLA Talk 1580.
KBLA 1580 Santa Monica.
I'm Amber Payton. Here's the latest on the Black Information Network. New York City Mayor Eric Adams is meeting with college leaders amidst ongoing pro-Palestinian protests aiming to prevent escalation. Adams, who is black, emphasizes that schools like Columbia and NYU